Hi nurses!
Hi.
Today we're going to be performing assessments on college-age students at Valencia Clinic. And before you guys get started, we're going to go over some key objectives you should aim to strive to achieve during them. Okay, so one thing you should definitely be on the lookout for is to incorporate developmental theories. That includes the wear and tear theory of like as you grow older, you know, through hard use, you can see it, but you probably won't see it as much with this age range. Developmental stages, such as Javier's theory with, you know, them looking for future families with careers and growth. And then you also need to assess habits and educate about health risks. That is key important, especially in relation to sexual health and domestic violence. You can also look out for mental health, so don't be afraid to ask questions. And just to go from the fun part. So do you guys have any ideas on theories? Can you incorporate? Yes?
Erickson, the isolation versus intimacy.
Really? And what would be incorporated in that section?
In this stage of life, they are focused on building meaningful and satisfying relationships with their friends and partners in their more mature relationships.
Okay, good. And piggyback offing of that, we can go with mental health. Like I said, you can ask further questions. And with dietary, nutrition, and concerns, we all know this age range isn't really known for their special diet. So can someone please give me an example of a dietary perfect nutrition?
Okay, should be like diet rich in vegetables, fruits, fiber, do exercise at least 30 minutes per day, and drink water.
Okay, good.
Okay, so now that we covered those, we're going to talk about the 18 to 34-year-old range and their physical development. Their physical development at this age, they actually should be in their top peak physical condition. However, you do have the outliers that may have a family history. So you want to make sure when you are in front of them, you want to assess their family history, anything that could kind of counteract them being healthy at this stage, because technically they should be. So you want to make sure you ask about family history, mental health, anything they do or don't do to promote their own wellness. You want to ask about any STDs. I know it may be uncomfortable, but just try to make them as comfortable as possible when you ask about that. Any domestic violence, it could be with a significant other, anything in their family maybe. So just making sure you hit those type of assessment questions, because that's what's important with this age group. And maybe even asking about what they do to prevent STDs and pregnancy is very important with the college age group. Anywhere in that age bracket, because like I said, unless they have a family history, they should be overall pretty healthy.
Okay.
Do you guys have any more questions before we get started?
No, I think
Alright.
we should be okay.
Oh, without further ado, let's go see the patient.
Good morning. My name
Hello.
is Karina. I'm gonna be your nurse today. This is Audrey. She's a nurse too. She's gonna be presenting.
Okay.
Okay.
Two nurses?
How are you? So
Hello.
nurses, it's
Yeah,
okay
that's
for
my
you?
sister.
Hi, I'm Brittany. I'm his sister.
Hi, I'm
Brother-in-law,
Karina.
I
I'm the
don't know.
nurse.
I don't know.
It's okay for if we both are here?
Yeah, that's fine.
Yeah.
I guess it's fine if you're here too.
Okay. So we need to verify some information first. Can you please tell me your name?
It's Justin Smith.
Okay. Justin Smith. And your date of birth?
January 1st, 1997. I'm a New Year's baby.
Okay.
I love to party.
Do you have any allergies to any medication, food, environmental?
No, nothing like that.
Okay. Any pain? A scale of 0 to 10? 0 pain?
About 5
How about 5? Where is
Yeah.
the pain located?
in my stomach.
In your stomach? When the pain started?
I get a lot.
Yeah. So, but you don't know if it started like yesterday or
No.
the day before?
No, I don't really know what causes it either, but
Can you describe the pain?
just hold on a second.
What is that?
What are you doing? You can't do that.
I brought you a
That's
glass.
I don't want that.
What do you mean?
Give me that.
What is
Oh.
that?
He
Oh,
has a problem.
it's not. That's just my.
Let me
I
see what
drink
is
that.
Let me see. I think it's
You brought that
I
into
bring
the
that.
clinic?
It's just water.
No, it's not.
I bring that everywhere.
Yeah, I know, and that's the problem.
So do you drink alcohol?
Yes.
I guess.
How
Yeah.
often do you drink alcohol?
Just on the weekends.
That's
you know,
a lie.
like, I mean, it's
Don't
a
you lie.
Well, maybe on the weekends and sometimes on every other day.
No, he drinks at least 5 to 6 days a week, and he's been doing it since
Well, I
our
take a
dad
break for
passed away.
Sunday because the Lord.
He's been doing it since our dad passed away more frequently.
Well, that might be.
So when
True.
your father passed away?
A
I
year
guess-
ago.
A year ago. Okay, can
Yeah.
you please lay down? Let me assess your pain.
Sure.
And have you been excessively tired lately, or is your
Yeah, I get tired a lot when I'm
And-
feeling down.
have you ever lost interest in anything that used to give you pleasure or you like doing?
I used to be really into school, but now I
Now
can't
he
really
doesn't even
focus
go.
and I fail.
And have you ever had any feelings about hurting yourself
Ow.
or hurting anyone else?
Kinda hurts. No, not really that.
Unless you consider drinking himself to death.
Okay, I have
Hurting
bowel
himself.
I'm
movement.
not drinking
I'm
myself
gonna
to
be
death. I'm perfectly
palpating
fine.
you. Okay, I'm gonna be palpating you. You might feel discomfort since you're having pain.
Ow, yeah,
Okay.
yeah, no,
Yeah.
please.
So,
Okay, do you wanna sit?
your
Let me
alcohol-
help you to sit. So you
Hurts.
said that you've been drinking alcohol almost 5 days a week.
Yeah, I guess realistically, probably like
Mhm.
6. Or
Do you
7.
have any burning sensation?
Yeah, I get really bad burning in my stomach.
Okay. So I think that's
I don't know. I guess it's not normal for people my age to be drinking this much.
and that could be a reason as to why you could further have problems with your liver in the future, and we could provide you some help or therapy if you would like.
My dad
With
died
your-
of liver failure, but I think that was just because he took a lot of Tylenol all the time. It couldn't have been because of drinking.
Well, we could get you in some programs that may help you with your feelings or maybe help you overcome this so
Wow.
you can prevent problems in your future.
Will you come with me to the
If you
session?
need me to go, I'll go.
okay.
I
I'll
guess
be
that'd
there
be
for
good.
you.
Thank you.
That you have family support. That's really, really good. Okay, so we're gonna tell the doctors our findings. So he's coming back to check on you in
Okay.
time. Okay.
Thank you very much.
Okay.
Have a good
bye.
day.
See ya.
Hello, how are you today?
Good.
My name is Justin. I'm going to be your nurse for today. Is it okay if I verify some information?
Yeah.
Ooh, watch out. Can you tell me your name and date of birth?
Audrey Marriage, January 17th, 1999.
And do you have any allergies, food, environment, contact, anything like that?
Nope.
No? Okay. On a scale of 0 to 10, Audrey, 0 being no pain, 10 being the worst pain you've ever experienced, how would you rate your pain right now?
4.
4, where's your pain?
This mole right here.
This mole. Let me take a look at that. Okay. So I see this. It looks okay. It looks normal. When did this pain start?
I started looking up symptoms online, and I think that I have skin cancer, and they say pain is one of them.
Pain's one of
A symptom.
pain's one of the symptoms.
Yes.
Okay. Do you often get worried about your health?
Yes.
Okay. We'll have to get confirmation from the doctor. Based on what I'm seeing here, your mole does look fine. It actually looks more like just a freckle. Skincare is very important for people of your age group due to increased exposure to ultraviolet rays from being outside, having an active lifestyle, and also from not wearing sunscreen as much as you should. Do you wear sunscreen often?
Yes, I'm very active outside.
You're very active outside. That's really good. Can I ask you a few questions about your mental health?
Yeah.
Okay. Do you often have excessive worrying
Yes.
related to your health?
Yes.
Do you have racing thoughts
Yes, and my heart is pounding on my chest.
right now?
Yes.
Okay. Do you often have trouble falling asleep at night or can't sleep due to those kind of thoughts and
I
things
don't
like
sleep
that?
a lot at all.
Okay. So I actually want to, I'm going to have a doctor look at that mole just so you can have peace of mind. I also want to see if we can get you a referral for some mental health services. I'm going to confirm that with your doctor. Anxiety is one of the things that affects people of your age group, so I just want to, cover all our bases and see if we can talk to a doctor about that. Okay?
Okay.
All right.
Thank you.
Hello, how are you?
I'm still with my burning
So
sensation.
with your burning, yes ma'am. Is it okay if I verify some information before we get
Yes.
started?
Okay.
Can you tell me your name and date of birth?
Mary Smith, 9989.
Do you have any allergies to food, environment, contact, anything like that?
Not that I know.
Okay, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever experienced, how do you rate pain?
It's not like pain, it's my burning sensation.
It's that burning you told me about
4,
earlier when
yeah.
I was in. It's still a 4 from when I last came in.
Yes.
So I do have some news related to that pain. You do have, the results came in, you have chlamydia.
What is that?
It's a sexually transmitted infection. I know you told me before that you don't have multiple partners. I do want to ask again, have you had multiple partners in the last 6 months? And
To
how
be
many?
honest, yes, I'm married. I told you that before.
Yeah, you did tell me.
But I also had a boyfriend,
Okay.
and he's married too.
Okay. Has your husband or him been tested recently?
I
Do we
don't
know?
know. I don't know.
And I do want to ask, do you guys use protection? You and your husband, or you and your boyfriend?
Sometimes we use, but not all the time.
Not all the
No.
time. Okay. So with this diagnosis, I do want to just reiterate the importance. It's very important not only to prevent getting pregnant, but it's also very important to use condoms, methods like that to prevent sexually transmitted infections. Unfortunately, with your age group, it is very prevalent. It's something we definitely need to watch out for. Okay?
Okay.
I do want to ask, is the relationship between you and your husband okay?
Yes, it is. I just like to have different.
Are there
partners.
there's no times when you feel unsafe being with your husband?
No, he's nice. Yeah, he's nice.
Okay. Well, I know you do say that now, but I do just want to mention that there are hotlines that you can call. I can give you pamphlets on the information about that. And there's also any healthcare provider you should confide in if you ever feel unsafe or, like you're, in danger. You just go
Okay.
ahead and let one of us know. So since I have given you your lab results, we are putting in an order for antibiotics.
Okay.
This is going to help clear up the infection. I would stress getting your partners tested because they may have it too. Okay?
Oh, okay.
Okay. You have a good day, all right?
Okay.
I'll come
Thank
back.
you. Thank you.
Hi.
Hi, I'm back.
Hello.
Before I get started, can I please just verify some information with you once again?
Sure.
Please tell me your full first and last name
Brittany Lyon,
and your date of birth.
4789.
And do you have any known allergies to food, medications, environmental factors?
No.
Okay. All right. So I actually just came back from talking with the doctor, and we went over that the fact that we found hypertension concerns us, and I wanted to ask you, what does your daily food intake look like?
I eat a lot of fast food. I don't like to cook, and I just do it simple.
Just simple? Okay, definitely incorporating healthy food items to your diet is extremely important. I'd actually get to give you a brochure. It's from byplate.gov. It'll help incorporate some whole grains, fresh fruits and vegetables, and there's actually already a doctor's order to recommend you to a dietitian. And they'll definitely be able to smooth over some things to help incorporate to your busy lifestyle. And it's very important to not only incorporate those changes now while you're young, but to also prevent future ailments such as diabetes, stroke, heart attacks, and the like. And is that okay with you?
It will tell me what are whole grains, because I don't know what those are.
They're definitely a healthier form of wheat than your typical white bread.
Oh, okay.
And I'll definitely be sure to contact the dietitian per the doctor's order. Is there anything else I can do for you?
How do I lose some weight? Because he talked about weight loss too, and
Oh,
I don't like to work out.
don't like to work out. Definitely having daily exercise is important, but definitely when the changes come gradually, you can just take a short walk and then proceed on further.
Okay.
And now, is there anything else I can do for you?
Nope.
No? Okay. I'll return shortly.
Okay.
Thanks for watching!